Introduction. Welcome to today's lecture on endocrinology, specifically focused on the intricate interplay between hormones and mood disorders. In this comprehensive script, we will delve into various aspects of the endocrine system and its influence on mood regulation. This knowledge is crucial for medical students as it provides a deeper understanding of the underlying mechanisms involved in mood disorders and paves the way for improved treatment strategies. Let us embark on this enlightening journey by exploring the first topic, HPA axis dysregulation. The hypothalamic pituitary adrenal, HPA, axis is a complex neuroendocrine system responsible for maintaining homeostasis and responding to stressors. Dysregulation within this axis has been implicated in various mood disorders, including depression and anxiety. At the core of HPA axis dysregulation lies the hypothalamus, which produces corticotropin-releasing hormone, CRH. CRH stimulates the anterior pituitary gland to release adrenocorticotropic hormone, ACTH. Subsequently, ACT stimulates the adrenal glands to produce cortisol, a key stress hormone. In individuals with mood disorders, hyperactivity of the HPA axis is often observed, leading to elevated levels of cortisol. Chronic exposure to high cortisol levels can impair neuronal function and disrupt neurotransmitter balance, contributing to the development and persistence of mood disorders. Thyroid hormones play a crucial role in regulating metabolism, growth, and development. However, their influence extends beyond these functions and encompasses mood regulation as well. Inadequate production of thyroid hormones, as seen in hypothyroidism, has been associated with depressive symptoms. Conversely, excessive levels of thyroid hormones, as observed in hyperthyroidism, can induce anxiety and irritability. Thus, maintaining a delicate balance of thyroid hormone levels is essential for optimal mood regulation. Thyroid hormones exert their effects on mood through interactions with neurotransmitters, particularly serotonin and norepinephrine. Imbalances in these neurotransmitter systems have been implicated in mood disorders, further emphasizing the intricate relationship between thyroid hormones and affective disorders. Gonadal steroids, such as estrogen, progesterone, and testosterone, are primarily associated with reproductive functions. However, emerging evidence suggests that these hormones also influence mood and emotional well-being. Estrogen, in particular, has been linked to a reduced risk of depression in women. Its decline during menopause is associated with an increased vulnerability to mood disorders. Similarly, fluctuations in progesterone levels during the menstrual cycle can impact mood, leading to premenstrual dysphoric disorder in susceptible individuals. Testosterone, predominantly found in males, also plays a role in mood regulation. Low testosterone levels have been associated with increased risks of depressive symptoms and decreased overall well-being. The intricate interplay between gonadal steroids and mood disorders highlights the importance of considering hormonal influences in the diagnosis and treatment of depressive and anxiety disorders. Neurotransmitters, including serotonin, dopamine, and norepinephrine, are well-known regulators of mood. However, their interactions with hormones further shape mood regulation processes. For instance, serotonin, often referred to as the feel-good neurotransmitter, is closely linked with various mood disorders. Hormonal imbalances, such as alterations in estrogen or thyroid hormone levels, can disrupt serotonin signaling, leading to emotional dysregulation. Dopamine and norepinephrine, on the other hand, are crucial for motivation, reward, and focus. Dysregulation of these neurotransmitters has been implicated in mood disorders like depression and bipolar disorder. The intricate crosstalk between hormones and neurotransmitters underpins the complex nature of mood disorders, necessitating a comprehensive understanding of both endocrine and neurochemical pathways for effective management. Stress hormones, primarily cortisol, are key players in the body's response to stressors. While acute stress can be adaptive, chronic stress has detrimental effects on mood and mental health. Excessive or prolonged exposure to stressors triggers the release of cortisol, disrupting the delicate balance within the HPA axis. Chronic elevation of cortisol levels can lead to structural and functional alterations in brain regions involved in mood regulation, contributing to the onset and perpetuation of mood disorders. Furthermore, stress hormones interact with other neurotransmitter systems, such as serotonin and gamma-aminobutyric acid, GABA, further exacerbating the dysregulation observed in mood disorders. Understanding the impact of stress hormones on mood disorders is vital for effective stress management interventions and therapeutic approaches targeting the HPA axis. Growth hormone, GH, is primarily recognized for its role in physical growth and development. However, emerging evidence suggests that GH also has implications for mood regulation. GH acts on various brain regions and influences neuronal function, neurogenesis, and synaptic plasticity. Disruptions in GH secretion or signaling have been observed in individuals with mood disorders, particularly in those with comorbid conditions such as depression or bipolar disorder. Furthermore, GH interacts with other hormones, including insulin like growth factor 1, IGF-1, which also plays a neuroprotective and mood-regulating role. Understanding the mechanisms by which GH influences mood may provide insights into potential therapeutic avenues for mood disorders. Melatonin, the hormone responsible for regulating the sleep-wake cycle, has garnered attention in the context of mood disorders due to its interactions with circadian rhythms. Circadian rhythm disruption has been observed in individuals with mood disorders, suggesting a potential link between abnormal melatonin secretion and mood dysregulation. Melatonin receptors are present in brain regions associated with mood regulation, such as the hippocampus and prefrontal cortex. Abnormalities in melatonin receptor expression or melatonin production may contribute to mood disorders, particularly those characterized by sleep disturbances, such as insomnia or seasonal affective disorder. Exploring the relationship between melatonin, circadian rhythms, and mood disorders may unravel new avenues for therapeutic interventions targeting sleep-wake disturbances. Vasopressin and oxytocin, collectively known as nonapeptides, play critical roles in social behavior, bonding, and emotional regulation. Vasopressin is involved in the regulation of stress response and is thought to modulate aggressive behavior. Dysregulation of vasopressin has been associated with mood disorders, including major depressive disorder and postpartum depression. Oxytocin, often referred to as the love hormone, promotes social bonding and facilitates trust and empathy. Dysfunctions in the oxytocin system have been implicated in mood disorders characterized by impaired social functioning, such as autism spectrum disorder and social anxiety disorder. Understanding the roles of vasopressin and oxytocin in mood regulation provides crucial insights into the social aspects of mood disorders and opens the possibility of novel therapeutic interventions targeting these signaling pathways. Prolactin, primarily known for its role in lactation, has also been attributed to various mood-regulating functions. Prolactin receptors are present in brain regions implicated in mood disorders, including the hypothalamus, amygdala, and hippocampus. Altered prolactin levels have been reported in individuals with mood disorders, with both hyperprolactinemia and hypoprolactinemia associated with depressive symptoms. Furthermore, medications that target prolactin release or prolactin receptors, such as antipsychotics, can impact mood and emotional well-being. Understanding the intricate relationship between prolactin and mood disorders may shed light on the neurobiological mechanisms underlying these conditions and inform potential therapeutic strategies. Insulin, primarily associated with glucose metabolism, also plays a role in mood regulation through its interactions with the central nervous system. Insulin resistance, a condition characterized by impaired insulin signaling and high blood glucose levels, has been linked to mood disorders such as depression and bipolar disorder. Insulin receptors are abundantly present in brain regions involved in mood regulation, including the hippocampus, amygdala, and prefrontal cortex. Insulin dysregulation can impact neuronal function, neuroinflammation, and neurotransmitter imbalances, contributing to the development and progression of mood disorders. The intricate link between insulin resistance and mood disorders underscores the importance of integrated approaches targeting both metabolic and psychiatric aspects for comprehensive patient care. Adipokines, hormones secreted by adipose tissue, not only influence metabolic processes but also impact mood regulation. Leptin, an adipokine involved in appetite regulation, has been linked to mood disorders. Alterations in leptin levels have been found in individuals with depression and stress-related disorders. Dysregulation in the leptin system can affect neurogenesis, synaptic plasticity, and neuroinflammation, contributing to mood dysregulation. Additionally, adipokines such as adiponectin and resistin have also been associated with mood disorders, highlighting the intricate connections between adipose tissue and mood regulation. Exploring the role of adipokines in mood disorders may provide insights into the interplay between metabolism, energy balance, and mental health, paving the way for novel therapeutic targets. Cytokines, molecules involved in the immune response, have gained significant attention in the field of mood disorders due to their potential contribution to neuroinflammation and mood dysregulation. Elevated levels of pro-inflammatory cytokines, such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, have been observed in individuals with depression and other mood disorders. Chronic inflammation can disrupt neurotransmitter balance, impair neurogenesis, and increase oxidative stress, all of which have implications for mood regulation and mental health. Understanding the role of cytokines in mood disorders provides insights into the pathophysiology of these conditions, encouraging the exploration of anti-inflammatory strategies as adjunct treatments for mood disorders. In conclusion, this comprehensive script has covered various aspects of the intricate relationship between hormones and mood disorders. From dysregulation of the HPA axis to the impact of thyroid hormones, gonadal steroids, neurotransmitter hormone interactions, and stress hormones, we have explored the multifaceted nature of endocrine influences on mood regulation. Additionally, we discuss the role of growth hormone, melatonin, vasopressin, oxytocin, prolactin, insulin resistance, adipokines, and cytokines in mood disorders, highlighting the wide-ranging effects of hormonal dysregulation on mental health. By understanding these intricate mechanisms, medical students can develop a holistic approach to the diagnosis, treatment, and management of mood disorders, ultimately improving patient outcomes and quality of life.